Family history, Pablo? You know anything about that from a cardiovascular standpoint, or diabetes, or?
No, not that I know.
Okay.
He certainly has gone through an ACL reconstruction on his other side. When I saw him, he was in great spirits and he understood the plan of care, and he was excited to get going.
I had 2 appointments with 2 different doctors before I met Dr. Larson. So people were talking about Dr. Larson, so I wanted to meet him before I make a decision. And as soon as he walked through the door, I knew before he actually opened his mouth, so I said, no, that's him.
The unique parts of dealing with the athlete is really taking the first 5 minutes to get to know them. I mean, you kind of listen to them, you're talking, but you're listening to them. You kind of read, sometimes you see immediate trust, sometimes you see distrust, they're concerned. I mean, you just really have to figure the athlete out in a hurry to sort of gain that, patient-physician relationship. Whether you're a recreational athlete or professional athlete, you have to get that as quickly as you can. I think every single person he saw, from Dr. Wolf to the other physicians to myself, we're all gonna take good care of him and make sure that procedure went perfectly, make sure his rehab went well. It was probably, I'd worked with, professional athletes in the past, and so I had a lot of experience with professional athletes, and that's important. I mean, one of the things that the athletes will oftentimes ask me when they come in is, they're like, who have you worked on? Who are your other clients? And they want to know that. And there's that level of confidence that comes with knowing you have dealt with this level of athlete in the past.
Last time you had something to eat.
Pablo, can you open your eyes for us?
Basically, we found inside of his knee that he had an ACL tear, so no surprises, went exactly along with the MRI. Looked like some of the other injuries he's had, the ligament injuries, are healing up nicely, so that's important for us to know. His ACL reconstruction went perfect. So again, we used the hamstring tendons, which is one of the options to use. He had nice big tendons, so we were able to use a big graft for that ACL, and the rest of his knee, the articular cartilage, the meniscus, everything else that can also potentially be injured, looked perfect. And surgery couldn't have gone better, and we expect him to do well, and now we just need to be patient and allow him to recover, and all the work is with his athletic training staff.